Okay, let's say a few things about now. Actually, see, we're running out of time and we're going to be scooted out of here. So I do have some points to address on the immune system and managing risk of infection, or we can talk about neuropathy. Should we have a show of hands for immune system? Yes, yes. Okay, and a show of hands for managing neuropathy. Oh, somebody call it. It's dead heat. Dead heat. The neuropathies are putting their hands up again and again and again. Yeah. Do we maybe talk about neuropathy? You've got the information about immune system. The key messages there are you are at risk of infection, know the signs and symptoms of infection, and get treated quickly. Those are the top tips, really. And you've got some other tips in the slides. But we will spend the last 10 minutes talking about neuropathy. See, we've missed all of this. We haven't even had an opportunity to talk about bowels. And I'm a nurse. We love to talk about bowels, don't we? Yeah. Okay. So you've got lots of good notes here that you can look at all sorts of other aspects. And I'm very happy for people to contact me if they want to ask specific questions as well. I'll leave you my details. But managing peripheral neuropathy. Neuropathy is a condition which is increasingly more common in patients with myeloma because they're exposed to drugs that can damage the nerve system and give rise to peripheral neuropathy. Most commonly the drugs thalidomide and Velcade. But what is peripheral neuropathy? Well, it's a disorder that describes damage to the peripheral nerves. The peripheral nerves are anything outside of your central system. So your central nervous system is really your brain and your spinal cord. And that controls a lot of the major activities in the body. But the peripheral nerves are everything else. So all of the nerves that come off the spinal cord and the brain. And most commonly when we talk about peripheral neuropathy, we talk about symptoms in the real peripheries, the hands and the feet. And the damage caused by a variety of different things, including most commonly the drugs we give to manage myeloma, can cause damage to the nerves, which can give rise to symptoms of pain of a particular type, but also altered sensation, tingling, numbness, even some cramping, as these messages between the peripheries get mixed up within the messages in the brain. Okay, so what are the common causes of peripheral neuropathy? Well, the myeloma itself. Anywhere between about 1% and 10% of people have neuropathy caused by their disease itself, and they haven't even been treated yet. It's common with certain disorders as well. Those who have diabetes can commonly get neuropathy. Those with high alcohol consumption can get neuropathy, damage to the nerves. As we all get older, it's something we all have to look forward to as well. Certain infections, particularly viral infections. Has anybody had shingles? Yes, very common to have a reactivation of shingles caused by the varicella virus, which is related to the chickenpox, etc., which is often present in all of us by the time we get to a reasonable age. And when your immune system is lowered, the virus goes from being present to becoming active, and you can get a nasty dose of shingles. And that commonly causes harm to the nerves because it's where the virus lives. And so you can get neuropathic pain because of that. If you have particularly thickened blood because you've got a lot of the myeloma around, that can also contribute to neuropathy. And if we were to blame it on a few drugs, we would typically say thalidomide, Velcade, and vincristine, which some of you may have had. It's a chemotherapy drug we used to use a lot of. We use less frequently now. Okay? So symptoms, often mild to start with and can progress, particularly if you don't remove the factor that's causing it. Changes in sensation, including sharp pains, burning, tingling, shooting pains up the arms and the legs. Sometimes people describe a heaviness, pins and needles. People often describe to me that they feel that they are walking on bubbles. Or somebody described as I'm walking on cauliflowers. I don't really feel the floor. There's something wrong with the way I am having a relationship between my foot and the floor, and it feels funny. And that can have on effects if you were to trip over something, such as you folk on here, don't trip over the wires, and then you fall over, and if you've got bone disease, you can cause a fracture or something. So the altered sensations also can cause problems with us managing activities that require dextral feelings. So, for example, picking up a pen or being able to open a newspaper and divide a paper like that. You can have difficulties doing those kind of things, doing up the buttons on a shirt or something like that. And it can also result in having muscle cramps. Has anybody been experiencing muscle cramps? Yeah. Now that can be signs of a neuropathy, particularly if you've got some of those causative factors going on, but it can also be an imbalance. We talk about that word balance a lot, don't we? And if it isn't because you're on a drug that causes neuropathy, then I would suggest you take, if you're having cramps, you can do some things like taking an isotonic drink, such as the sports drinks that have, because it can be due to an imbalance of your electrolytes. So try that, or try some magnesium supplements, can really help with muscle cramps as well. Even if it is neuropathy, try magnesium supplements. So how do we manage neuropathy? Well, we don't have a magic bullet to manage it, otherwise none of you in this room would have it. But the key to managing it is to eliminate the cause, reduce the cause, or to develop a balance between if it is the treatment that is working against your disease, but it's giving you a degree of neuropathy, we need to balance that. Because some neuropathy may well actually not improve when you take the drug away. So we do need to, you need to be communicating with your specialist as to how the neuropathy is going, because he may want to dose reduce or remove that drug completely. We can monitor the signs and symptoms. Has anybody had any nerve conduction tests done in the neuro labs to assess the degree of nerve damage? No? Yeah, you can have that done. Sometimes just the doctor with a pinprick and assessing your tendon reflexes and things like that can be assessing the degree of neuropathy. These complex neurological exams sometimes can be quite painful, which is why we don't routinely do them unless we think you have a significant problem. And we need to manage, and we can grade the degree of your neuropathy by doing these tests, and that helps us know when to perhaps stop with whatever's causing it. And early intervention is absolutely essential because, as I said, in some cases, even taking the cause away doesn't stop the neuropathy. Some of the things we use, if you are having sharp pains with the neuropathy, we need to use particular types of pain medication. In Australia, we need to refer you to a neurologist, a nerve specialist, to prescribe those particular nerve painkillers, but you may be able to get them here without that, and they're listed there for you. But the key to managing it is to actually try and reduce the causative effect, which most commonly is to reduce the dose of the treatment that's causing it. Other things that we can do to intervene. So, for example, in terms of reducing the dose, has anybody had their drug doses reduced because of neuropathy? Yeah, quite a lot of hands going up. Yeah, were you on thalidomide at the time of having that, or Velcade or something? Yeah. Thalidomide, yes. So your doctor was assessing the degree of your neuropathy and then reducing how many tablets, or perhaps even stopping you completely on that drug. Yeah, some nods coming here as well. It is something we need to do, particularly the thalidomide-induced neuropathy tends not to improve when we stop the drug, and that's why we need to keep that lines of communication open, because we don't want to leave you with too high a degree of neuropathy. The Velcade-induced neuropathy sometimes behaves a little differently. They do say it can be a little bit more painful and sudden onset, but it can improve with dose reduction and may well actually go away completely when you come off the drug. But we've yet to learn fully how to manage that, I think. Some other things other than the actual painkillers that you can take are listed here. A lot of my patients find it, those strategies of commonsensical things really. Wear good shoes. If you can't feel the floor, don't wear, now what do you call it in New Zealand? Jangles? Jandals, not jangles. That's it. I learned that 5 years ago. Jangles, jandals, yes. So if you wear, shoes that you can slip out of, if you can't feel the floor, you're at risk of coming out of a slip-on shoe and causing a twisted ankle. So wear good shoes. Actually wearing good fitting, reasonably tight but not constrictive socks can help a lot, particularly at night. Wear socks up to here, those flight socks or something, maybe not quite as tight as that, but firm socks. That can really reduce the symptoms, particularly overnight. People do use techniques of massage or reflexology. Sometimes if you're very hypersensitive, that can actually be more unpleasant, but I do have patients that do use that. There's increasing evidence of the use of various creams And the creams of note are a cream high in vitamin E. The skin does not like to be dry, and neuropathy symptoms can be worse when your skin is dry. So the key message is keep your skin moist. There's some evidence that a cream high in vitamin E may work better. If you have troubling sensations, which particularly at night time keep you awake, then a menthol-based cream can be very soothing. So any cream that has menthol in it. I have a patient group down in the south coast of New South Wales that buy a big pot of horse liniment, and they use that, and they asked me my opinion, and I said, well, I don't think I can really approve horse liniment, particularly when it said not for human consumption on the side. But actually we looked it up, and it was about 90% menthol. And the other creams that are high menthol are the sports injury creams. And they can have an effect on the nerve sensations close to the skin and the cold-hot sensations, and actually can have a bit of a counteract the unpleasant symptoms of neuropathy and calm the area down. Doesn't always work, but it's worth trying, and you'll smell beautiful as well with it. I've also known people use a calamine menthol-based cream as well, and there's also evidence of the use, if you have very sharp tingly sensations, of using a capsicum cream, a chili cream, which again can have the sort of counteract the unpleasant sensations. Okay, so worth trying. Might not work. I have a lot of people that use menthol and do swear by it. Other strategies you can use. I learned from a man in New Zealand actually the use of silk pajamas, and that top tip has stayed on my slide since 5 years ago. Yes, and he used silk pajamas because if you have terrible neuropathy, and it can be worse at night, you really find distress when there's any contact with your skin. Hence, if you wear tight-fitting socks, the sock is tight against your skin and nothing else is rubbing against it, and it calms it down. But silk has very low resistance, and so he found he woke up less when he had silk sheets or silk pajamas because of the less contact resistance with the fabric. It also helps significantly if you have a lot of pain. If you have a lot of aches and pains in your body, and you wear, or you have silk sheets, or you wear a low resistant clothing to bed, you actually slip around in bed with a lot less resistance and less pain. So those of you who do have a lot of pain and you get woken up by turning over in the night, you actually twist around beautifully with these. The risk is that you can flip around and fall right out of bed, of course, so that is a risk, but that has worked with a few patients that I've suggested it to, so it might be something you want to try. Other supplements that people can use, magnesium I've mentioned for cramping. Vitamin B complex is thought to be neuroprotective, and a lot of patients do take that. A lot of diabetic patients take that as a supplement to prevent nerve damage, and they find it works well. There is ongoing research of the use of other supplements, and but as of yet we don't have strong evidence. I do use quite commonly a list of supplements that comes from my colleagues in America at the Dana-Farber, and I have that list electronically of these supplements listed, and I'd be happy to pass that on to anybody if that would be helpful. And I do have people that take them and find them very helpful. So I think I'm going to leave it there before we get thrown out of the Novotel. I hope I've provided you with some good information. We certainly haven't had time to cover everything, but you've got notes there on the areas we didn't cover. I'm happy to pass on those guidelines about the ONJ and also the supplements list for the neuropathy. There are also a variety of different patient resources that I'm sure you're very aware of, including the Leukemia and Blood Foundation, and a lot of, here in New Zealand, but also electronically, the big sites for myeloma. I would strongly suggest include, in Australia we have the Myeloma Foundation, in the UK they have Myeloma UK, and in America they have the International Myeloma Foundation and the MMRF. All are excellent sites and have a variety of different resources you can download on all the aspects we have spoken about today, just to back up what has been said. So thank you for your time and your patience and coming in on a cold wintry day. Thank you very much. Thanks so much, Becca. Thank you. It's been a pleasure.